So Dara-VCd is one of the options for transplant-eligible myeloma in the UK. It is administered as 4 cycles in induction with Daratumumab, Velcade, Thalidomide, and Dexamethasone. So we give 4 cycles up front as induction for myeloma patients, and then they go on to receive, they go on to get harvested and then receive an autologous transplant. After transplant, they then receive 2 cycles of Dara-VTd, of consolidation, and then they move on to Lenalidomide maintenance. Our experience of this has been very positive. We've had the majority of patients achieving a very good response or better with this, and 21 out of 24 patients going on to be successively harvested. We have we did an audit looking at the monitoring during Dara-VTd and how we can improve that. And we found that the majority of patients are having adequate monitoring in terms of HbA1c. We've found that most of our patients are going on to also receive bisphosphonate therapy, and that we also looked at the escalation of thalidomide doses in relation to peripheral neuropathy. And we found that we were doing that appropriately, and we have also introduced within our center protocols to help sort of streamline those electronically.